All right, future doctors, welcome. If you are prepping for your clinicals, you know that just nailing the thyroid exam is absolutely essential. So today, we're going to take all that textbook theory and turn it into a confident, real-world clinical skill step by step. So, picture this. You see a patient with a swelling in their neck. What's your first move? What's your second? The key isn't just memorizing the steps, it's having a system, a rock-solid plan that makes sure you catch every single clue. Let's build that plan right now.
Here's our roadmap. We'll start with prep and inspection, then we'll master palpation, cover percussion and auscultation, look for those all-important associated signs, and wrap it all up with a final review. Let's get into it.
Okay, first things first. Before your hands go anywhere near the patient, these initial steps are absolutely crucial. They set the stage for a really accurate and professional exam.
Think of these as your golden rules, the absolute non-negotiables. You always get consent. Then, get the patient sitting upright, nice and comfortable, and have them extend their neck just a little bit. That simple adjustment makes the thyroid gland so much easier to see and feel.
All right, with the stage set, let's move to the first pillar of our examination, inspection. You know, a careful, systematic look can tell you a surprising amount of information before you even lay a finger on the patient.
You're essentially building a mental blueprint of this swelling. Is it a generalized enlargement, kind of all over, or is there one discrete lump? Are there any old surgical scars that might tell you part of the story? Every single observation is a piece of the puzzle.
And now for the classic test. Hand the patient a glass of water and just watch closely as they swallow. See it move up? That's the hallmark sign. Now, why does that happen? It's because the thyroid is wrapped in this layer of connective tissue, the pretracheal fascia, and that's attached to the larynx. So when the voice box rises during a swallow, guess what? It pulls the thyroid right up with.
But this brings us to a really key differential diagnosis. You see a midline swelling, it moves with swallowing, but you need one more test, just to be sure it's not something else that can look very similar.
And this is just brilliant. It shows how one simple maneuver, just asking the patient to stick out their tongue, can help you tell the difference between a thyroglossal cyst and a thyroid swelling. It's a beautiful little piece of clinical deduction that's all based on embryology.
Okay, now we move on to palpation. This is where your fingers get to confirm what your eyes have already seen and gather way more detail about the gland's texture, its size, and its shape.
Now, you should know both of these, but honestly, LaHaye's method from behind the patient is generally the one you want to go with. It allows for better relaxation of the neck muscles, and that lets you do a much more sensitive and thorough examination of both lobes at the same time.
So, what's really cool about this is how much the texture alone can narrow down your diagnosis. A soft kind of boggy gland feels totally different from a firm, lumpy one. And listen, if you feel a rock-hard fixed mass, you have to have malignancy high on your list of possibilities.
Never, ever skip this step. Place your finger right in the suprasternal notch. Can you feel the trachea? Is it in the middle? A really big goiter can actually push it over to one side. Finding a deviated trachea is a major red flag for what we call a mass effect.
Okay, this is so crucial. Kosher's test isn't just for exams, it's a test for a potential airway emergency. That high-pitched breathing sound, stridor, tells you the airway is already compromised. And why? Because that sound is air being forced through a narrowed passage. It's a critical finding that needs immediate attention. All right, now for 2 quick steps. They're often overlooked, but they can give you some vital information, especially about parts of the gland you can't see or easily feel. So normally, when you percuss the manubrium, it sounds resonant. But if it sounds dull, that suggests the goiter has actually grown downwards into the chest. And hearing a brute? Well, it's like hearing a traffic jam in an artery. It means turbulent, high-volume blood flow, which is a classic sign of Graves' disease.
You know, a thyroid problem is rarely just a neck problem. It's a systemic one. So now we have to zoom out from the neck and look for the signs of thyroid dysfunction all over the body.
First, let's hunt for evidence of an overactive thyroid. The most dramatic clues are often found in the patient's eyes, so that's exactly where we're going to start.
These signs are all driven by sympathetic overstimulation. Lid retraction. That creates that classic stare or deer in the headlights look. To test for lid lag, just hold your finger up and ask the patient to follow it down. If you see the white of their sclera above the iris as their eye moves down, that's a positive sign. The eyelid just can't keep up.
These are such simple, powerful bedside tests. That fine tremor is from a heightened sympathetic tone. The warm, sweaty palms are because of an increased metabolism. And a racing pulse, That's a direct effect of way too much thyroid hormone on the heart.
And remember to always consider the opposite. As you're looking for signs of an overactive thyroid, keep the signs of an underactive one in the back of your mind. Is the patient slow and lethargic? Is their skin coarse and dry? It's all about pattern recognition. Okay, we've done the work. We've gathered all the clues from inspection, palpation, and our systemic search. The final step, and this is the one that really matters in your exams, is putting it all together in a logical, coherent summary.
This is your presentation script. You start with the local findings, the swelling itself, then you broaden out to its local effects like tracheal deviation, and finally you paint the systemic picture. And please don't forget to complete your exam by feeling for those cervical lymph nodes. It is so crucial if you suspect malignancy.
And this right here is the entire point. You're not just going through motions, you're gathering evidence. This systematic approach is exactly how you build a powerful case for your differential diagnosis. Master this, and you're mastering a true cornerstone of clinical medicine.